Our first section is Original Medicare Part A and Part B. In this section, you'll learn what is covered and what is not covered by Part A and Part B. So under Original Medicare Part A, which is your hospital insurance, it covers inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. Now, the costs on Part A are premium free if you've worked 40 quarters, so there is no cost. There is a deductible under Part A. Changes every year, so it just depends. It goes up a little bit each year. Coverage, it covers stays of more than 60 days, have some daily copays. You can utilize any hospital that accepts Medicare, and hospital care outside of the United States is not covered. So please keep that in mind. Okay, Original Medicare Part B covers your doctor and outpatient visits. So that will be physician services, outpatient hospital services, ambulance, outpatient mental health, laboratory services, durable medical equipment such as wheelchairs, oxygen, things like that, outpatient physical, occupational, and speech language therapies, and some preventive care. So now the costs on Part B, there is no out-of-pocket maximum, but this is a little different than Part A in that the Part B is an 80-20 split. Medicare pays 80%, you're responsible for 20% of Medicare approved costs. Now Part B does have a monthly premium, which is adjusted based on your income, and it usually goes up every year a little bit, so please keep that in mind. And you may pay a higher premium if you sign up after your initial enrollment period. So a little confusing there, but what it basically says is once you're eligible for Part B, you need to sign up unless you have a credible coverage through your group, and then you don't have to sign up for it. But please keep that in mind. If you have a question about that, you can always call us. It also has an annual deductible. It's not very large, but it does also go up a little bit each year. Coverage, physicians, and you can go to any physician who accepts Medicare. And some preventive health care is provided. What's not covered? Under Part A and B, Medicare Part A and B deductibles are not covered, coinsurance and premiums. You have something called Medicare Part B excess charges. This comes into play if you have a doctor that does not take what Medicare will pay them. They may charge a little bit more, so you would be responsible for that. Again, that may be something that you want to talk over with us. Prescription drug coverage is not covered under Part A and B. Additional benefits such as hearing, vision, and dental are not covered, and also long-term care or custodial care if that is the only care you need. So that would be most nursing home care is considered custodial care, so that would not be covered. So in this section, we learned about Medicare Part A and B, what is covered and what is not covered.